Good afternoon, everyone, and welcome to our final day of the Boys Town Pediatrics Fall Newborn Expo. My name is Gabby, joined here today with Dr. Monica Kelly, and we're going to be going through several questions that kind of answer, is this normal, baby edition? So if you remember, or maybe if you were present for our last Newborn Expo that we did in the summer, we did a version of this more focused on pregnancy. And so now these questions are going to be very geared towards baby, which definitely is appropriate for the expo. So as we go through our discussion questions, if you have questions for Dr. Kelly, go ahead and leave them in the comment section of this video and make sure you give it a like. Additionally, we will be doing in-person meet and greets next week on November 10th, and Dr. Kelly will be present for that. So if you want to sign up for a slot to meet Dr. Kelly and get to know her, potentially consider her as a pediatrician for your baby and your family, we'll put that link in the comments too. Okay, so Dr. Kelly, how are you doing today?
I'm well, thanks. How are you, Gabby?
Great to have you on. So let's start at birth. When babies are born, they vary in look. So let's talk a little bit about that for our pregnant moms that are watching. Why are newborns sometimes swollen after birth is the first question.
Yeah, there are two main reasons newborns are swollen after birth. One is often mothers will get a lot of fluids while they're in labor, and the fluids do transfer through the placenta, so the baby can get a little swollen from that. And then also they do have just some birth trauma from coming out, and that can make them a little swollen. So often in the first few days they're swollen, and then it just kind of goes away on its own. Oh, I think you're still muted, Gabby.
Sorry, I heard a plane going overhead, so I muted. Sorry. Why are some babies born with more hair than others, not just on the head, but also on the body?
Mm-hmm. So there are two main reasons. So your genetics plays a huge role in how much hair you have, especially on your head, how much hair you have. But then also your gestational age. So a lot of most babies have hair earlier on in gestation, and normally falls out around 36 weeks, but it can last longer. And so depending on when your baby's born, they'll have more or less hair on their body. And then the hair on the head is also very variable. And it doesn't, some people worry when their baby's born totally bald, are they not going to have hair? They almost always get their hair. It's just based on how their parents' hair looks, how your hair is going to look.
Yeah, definitely genetic. Can we talk more about why sometimes babies have a cone-shaped head after birth and sometimes maybe you have to wear helmets?
So that's two totally different things.
Okay.
So the different parts of your skull, you can't see my hands. They're not totally fused when you're born, and that's to help the baby come out, because babies' heads, even though they're small, they're still bigger than you necessarily want to push out. So the skull will often overlap a little bit in order to help it come out, and then as it comes through, it kind of molds into a cone shape, and that just goes away on its own. The reason some babies have to wear helmets is different. That's from positioning in the first few months of life. If they tend to look more to one side than the other when they're laying on their back, then one side of their head will get flat. And the helmet is to help with that.
Gotcha. So the next one is, my baby's eyes seem to cross as a newborn. Is that normal?
Yes. So as long as the baby's eyes are crossing intermittently, so not all the time, it's normal. And that's because they're basically just trying to figure out how to fixate on things. So for the first 4 months, it's totally normal to have intermittent crossing. If you feel like your baby's eyes are crossed all the time, then they definitely should be evaluated. But if it's just every once in a while, that's normal.
Okay. So every once in a while, up to 4 months is typical.
Yeah.
Cool. The next one, this one is a common question that we've gotten here. Sometimes my baby gets really aggressive hiccups and they almost seem painful watching them. Is that normal?
Yes, it's very normal. So we see babies getting hiccups all the time. Hiccups, although we don't totally understand what causes them, they're the diaphragm spasming. And it seems like because they're just getting used to the world, babies have them a lot more than older people. But that's totally normal. And it doesn't actually, it can be uncomfortable, but it's not actually hurting them.
Yeah, that's good. The next one says, my baby doesn't always burp after nursing. Is that normal or do I need to try something different?
Yeah, so the reason babies burp is they'll often swallow air while they're eating.
Mm-hmm.
And you can swallow air when you're breastfed or when you're bottle fed, but it's a lot of babies when they're breastfed don't swallow as much air. So many breastfed babies don't need a burp at all. So you can just kind of see how your baby is. So often, the first couple days at least try burping and just see if the baby needs to burp. And then if your baby never burps, then they just probably don't swallow air and they don't need it.
My baby sneezes a lot, it seems like. Is that normal?
Also very, very normal. They sneeze a whole bunch the first few weeks.
Yeah, it's really cute too.
It's very cute.
The next one is sometimes it seems like my baby's breathing is labored, both when they're sleeping and awake. Is that normal?
Yeah, so babies do something called periodic breathing where so they're breathing along the rate they're normally breathing, and then all of a sudden they'll start breathing kind of faster and deeper, and then they might slow down to slower than they were before, and that is normal for them. If you feel like so that would be kind of intermittent. If you feel like all the time they're breathing really heavy, we should probably take a peek at them and make sure that looks normal.
Yeah. The next one is, what is cradle cap? Is it normal? Is it common? And how can it be helped?
So the cradle cap, what it looks like is kind of yellow scales on your head. They're actually two, so it's called seborrheic dermatitis. Technically, there are two things that are called that. There's the scales on your head, and then babies will also get kind of a red rash on their face. It's very common. I think up to like 40% of babies get it. And we're not, like many things with babies, we're not entirely sure what causes it, but it seems like there may be a fungal component. For when it's on the head, what we do is have you put some sort of oil, like a baby oil, avocado oil, really, it doesn't matter what kind of oil, on the head, let it kind of soak and soften it up, and then use a really soft brush and just kind of brush it off. It normally comes off really well. Occasionally, if that doesn't work, we'll do a dandruff shampoo. Just an adult dandruff shampoo normally takes it off. And then the one that you get on the face, we just do lotion. And if that's not enough, we sometimes do a little steroid cream to get rid of it. But very, very common and treatable.
Good. So we're heading into the fall and winter months. What about babies who have dry skin? How can we keep that in good condition?
Yeah. So in the first few weeks, almost every baby, many, many babies will look like they have dry skin because the top layer of their skin gets all peely. And that's because that top layer has been exposed to water for months. And that's normal. You don't need to treat it at all. It just kind of comes off. Then once that layer is off, babies do often get dry skin. A lot of babies will get eczema too, which is worse if their skin is dry. So doing a really gentle lotion is a good idea. Just, totally unscented after you bathe them to just kind of protect the hydration of the skin.
Should you wait a while before bathing your baby when they're first born? I know some people do it at the hospital. Some people wait till you get home. What would you recommend?
Yeah, so I feel like hospitals are doing better now. They are waiting at least 6 hours, which is good, and probably more like 12 to 24 is ideal to wait.
Okay.
Just because the vernix that's on them is actually pretty good for their skin, so that kind of allows it to absorb. But you can definitely bathe the baby before leaving the hospital.
And then say you don't want to, say you want to wait. Is there like a maximum time that you're like, you need to bathe them now? Or is it?
No, that's just like a little stinky.
Yeah, I kind of figured that, but wanted to ask. What is normal for baby poop?
So baby poop is extremely variable. In the beginning, so colostrum is actually laxative, so it makes babies poop more. So babies that are breastfed initially will often poop quite a bit in the first, like once they start pooping, they'll poop quite a bit in the beginning. And then they often slow down a lot. So the like range of normal for a baby is pooping every time you feed them or not pooping for days on end. I mean, well, I'll have normal babies go a week or even over a week without pooping, and they do totally fine. They're not constipated. the breast milk is absorbed really well, so they just don't need to poop.
Yeah. Okay, well, that's kind of good to know that it's a range, so you don't have to worry if, they are going a lot or not going that much.
Yeah.
What about like poop color? Like or consistency, like if it's more runny or yellow, does that mean anything?
Mm-hmm. So yeah, so baby's poop almost always starts off looking like meconium, so it's really dark and sticky, kind of blackish.
Yeah.
And then as they're getting more, that poop is the amniotic fluid and skin cells and stuff that they swallowed in utero. That all needs to come out. Then it turns kind of green and then brown and then yellow. Normally is the progression.
Mm-hmm.
And then once it gets yellow, there is also a lot of variability. So like any shade of basically brown, most greens, yellow, orange, all of that's normal. And in consistency, kind of anywhere from pasty to really runny is normal. Probably the most typical that we see is what they call yellow seedy, and it kind of looks like mustard with like little seeds in it.
Yeah.
Almost like little cottage cheese inside mustard.
Yeah. Good to know. We talk about it all here at the Newborn Expo,
Yes.
so we got to get specific. All right, we've just got 2 more questions here for Dr. Kelly. So if you're watching live and you have a question, I see one here that we'll answer, but feel free to leave them in the comments and make sure you like this video. Sometimes my baby grunts and looks like he's going to poop, but then he doesn't. Is that normal? Is he just gassy, or what's going on?
Yeah, so that's also very common. And there's also kind of a range of how much babies will do that. Some babies just do it every now and then. And some babies do it a lot and seem to be kind of uncomfortable. So we get people coming in a lot saying like they think their baby's constipated because they look like they're trying to poop a lot and then they don't actually poop. And that is actually something called infant dyschezia. It just has a name because it's so common. It's not a disease.
Okay.
It just means, so in order to poop, you need to contract your abdominal muscles and relax your perineal muscles at the same time. So,
Yeah.
and babies will often clamp down both places at the same time. So it's like they're pushing against a closed door. So they're grunting and nothing's happening. And then they just need to learn to relax at the same time and then they poop. So it's often for a few weeks. They're just not really very good at pooping yet.
Yes.
But it doesn't mean, it's very common. It doesn't mean anything is wrong with them and we don't need to treat it.
Okay. So time will pass and they'll get the hang of it. And
yeah, exactly.
So the next question is about sleep, which I think we could probably do a whole talk about sleep. So I will mark that down for our next Newborn Expo. But this one says, my baby seems to be nocturnal. They sleep so much more during the day than at night. Is this normal and will it pass?
Yes, almost every baby is born nocturnal. And that's because when you're pregnant and you're walking around during the day, they kind of are rocked to sleep all day long. And then mom goes to sleep. They're not having that motion and they are often a lot more active at night. So a lot of mothers will notice as soon as they're ready to fall asleep, then they notice all the kicking and everything. So it's the same thing once they're born. And they just kind of need to learn to go to your schedule. So it will often take weeks to get them totally switched over. Luckily, when they're first born, they tend to sleep most of the time anyway. So even though they sleep more during the day, they will still sleep at night. And then getting their circadian rhythm on track with what we consider normal takes a while. But things like bringing them outside in the morning so they get a little sunlight in the morning, having just more noise and activity during the day, and then calm, quiet, dark at night, that helps get them switched over.
Perfect. Okay, so we have a few questions here in the comments section. Thank you for everyone who's left a question. If you're watching live, as we go through and answer these, feel free to leave any more and we can get them done. So the first one says, is it normal for a newborn girl to have white vaginal discharge? It just happened last night after her bath.
Yes, very normal. Lots of newborns have discharge. White is definitely the most common. Some little girls will even have a little period. And that's because they've been exposed to all of mom's hormones. And then when those kind of come away, then they'll have a little bit of bleeding. So if you see a little bit of bleeding in the diaper, that's normal. If it's a lot, we should take a peek.
Yes, that's good to know. The next one says, is it normal for babies to cry and be unable to get to sleep from 6 p.m. to 1 a.m.?
So, yes and no. It depends how. So it depends how, like, if it was the entire time. So we consider normal to be if you add up the crying, like the actual crying time. If you add it up, it should be about 3 hours or less. If it's more than 3 hours, you would technically be considered to have colic. But that is also very common to have colic. And so it doesn't mean there's something necessarily really wrong with your baby if they cry more, but it might be worth kind of troubleshooting with your pediatrician a little bit and see, like, is there anything we can do to decrease this?
Yeah, totally. And we did a Expo video on crying, so I'll link that for you who's watching, so you can, if you want to check that out. The next one is, how normal is excessive sleepiness when feeding for preemies? She's currently 8 weeks actual, 1 week adjusted. At what adjusted age would that be worrisome?
So it is very common for especially preemies, even term babies, to be sleepy when they're first born with eating. And it really depends. I can give you a very cut and dry answer of when it will stop, because it really depends on the baby when they stop being so sleepy with eating. So things that can help with that are skin to skin while you're feeding. Even if you're bottle feeding your baby, you can still do skin to skin while you're bottle feeding them. And then kind of tickling or rubbing their toes to keep them awake, or feet to keep them awake. You can even put like a wet washcloth on their feet if they really conk out when you're trying to feed them.
Yeah.
And then, yeah, it will get better. It just totally depends on the baby when it does get better.
Yes, perfect. Thank you for those questions. And if you are watching this video later after the live concludes and you still have a question on if something's normal with your baby, obviously it's all very situational, but we are happy to try and help. So go ahead and leave it in the comments or message our page privately and we can get that answered for you. I'll pass it along to Dr. Kelly. Awesome. Well, Dr. Kelly, thank you. I know we went kind of all across the board with this, and we could probably, like I said, go on forever with it, but I really appreciate all your expertise.
You're welcome.
Awesome. Well, thank you everyone for watching. If you missed, we went live all this week on the Boys Town Pediatrics Facebook page, so I'll make sure to link the other videos from this week for you to catch up and watch. As always, make sure to like this video. If you want to sign up for a meet and greet next week on November 10th, I will also link that. And best of luck with your pregnancies. If you haven't delivered yet, or maybe you've just recently welcomed a baby to the world, congratulations. And we appreciate you watching. So thanks, everybody.